am disappointed with Budget 2019. It did not address the key issues that are important for the future of Singaporeans. I will not deal with the Merdeka Generation Package and the bicentennial handouts. Many people consider them to be gimmicks created to buy votes for the forthcoming general election. The budget did not address the long-term challenges. What are these challenges? I identify 6 challenges: cost of living, healthcare costs, birth rate, national service, Central Provident Fund, HDB flats. Cost of living. We have perhaps the highest cost of living in the world. This is largely contributed by the high cost of housing, high cost of cars, high cost of healthcare. But there are many other factors that also contributed to it. The high cost has been around for many years. We have been rated the most expensive city and the most expensive country by various international studies and for many years. This rating reflects our failure, not our success. It is not something to be proud of. It shows the inability of the government leaders to provide an affordable cost of living for the ordinary people. The high cost of living brings several negative aspects: a high stress level, and inconsiderate people, and ugly people. Is it possible to bring down the cost of living? What can be done? My view is abolish GST. I'm not suggesting GST be lowered. I'm suggesting it be abolished totally. If we can abolish GST, we can bring down the cost of living by up to 10%. 7% is from the GST paid to the government. But consumers have to pay a higher price to cover the cost to the business of calculating, collecting, and accounting for GST. This is a heavy cost. It is hidden, but you can be sure it is added to the price that consumers have to pay. Can we afford to abolish GST? In my view, yes. GST brings $11 billion to the budget each year. Where can we plug this gap? If GST is abolished, we can plug this gap by adopting the correct accounting approach. We can adopt the approach recommended by the International Monetary Fund. I do not know why Singapore should adopt a non-standard approach in accounting and ignore the land sale in the budget. This figure, which is a large sum, disappears into the national reserves and is not accounted. If land sale, which some people estimate to be between $10 to $25 billion a year, is accounted according to IMF guidelines, we can abolish GST and still be in surplus. Instead of doing the right thing, which is to implement the International Accounting Standard, which allow us to abolish GST, the Finance Minister is talking about increasing GST from 7% to 9% within the next few years. This will add to the stress level and increase the cost of living further. Can we have a bold finance minister who can abolish GST totally and bring down the cost of living by up to 10%? Healthcare costs. Several international comparisons actually showed that Singapore has a high quality of healthcare, and surprisingly, the cost is quite modest compared to other advanced countries. But this is not the perception of many ordinary people. They are worried about the high cost of healthcare. Why is there a gap between perception and statistics? The main cause is our complicated system of MediSave, MediShield, MediFund, and CareShield. Although the public puts in a lot of money into these schemes, they find that these schemes do not cover the total cost of healthcare. They have to pay a significant portion of the bill out of pocket. There are many complicated rules about how much can be paid out of MediSave and from the insurance schemes. These rules take a lot of effort to calculate and are confusing to the general public. Even the hospital staffs find them to be quite difficult to explain. The accounts of the insurance scheme, called MediShield and CareShield, showed big surpluses. These schemes received large inflows in premium and relatively small outflows in benefit. Some people describe them as money-making schemes for the government. What can be done to fix this problem? We need to review and change our approach towards the control of healthcare costs. We should not allow the medical fees and charges to be determined solely by the hospitals and doctors. We need a more effective system to control these charges. We do not need to reinvent the wheel. Many countries have addressed this problem and found better solutions. We can study what is being done in Japan and in Taiwan. In Japan, the health authority negotiates with the medical providers on the fees that are charged for each treatment. The negotiation is carried out annually. The final fees are fixed at a level that is adequate for the providers and affordable to the payers. Ultimately, the fees have to be paid by the patients through taxes, insurance premiums, and out of pocket. However, we need a mechanism to ensure that the fees are reasonable and not out of control. Taiwan introduced its national health insurance system in 1995. Prior to deciding on their system, they sent their people to several countries to study the health insurance systems. They also visited Singapore. Our health authorities proudly explained to them our 3M system of MediSave, MediShield, and MediFund. Taiwan decided to adopt a national health insurance system. It is one system and is not made up of 3 separate components. I read a report from a Singaporean who recently migrated to work in Taiwan and was there for a few years. He compared the health insurance system of Singapore and Taiwan. He found the Taiwan system to be better. The people do not have to worry about paying high fees for treatment. The cost to them is lower than in Singapore. I suspect the quality of healthcare in Taiwan may not be up to the same standard and luxury as in Singapore, but it is probably adequate. Low birth rate. We have one of the lowest birth rates in the world. This problem has been with us for over 3 decades. Our low birth rate is largely caused by the high cost of living, insecurity of jobs, inadequate wages, high cost of raising children, and delay in getting married due to national service. We have tried many ways to address this problem since 1985. We have implemented many baby packages in past budgets. These packages comprise of several incentives to encourage families to have more children. They have largely failed to achieve the goal. In my view, these packages failed because they were too complicated and were largely inadequate. Many people were not sure what they can get and how they can use the benefits. They do not have the time to figure out the complications. They decided to have fewer children. We cannot continue to have a low birth rate and a decline in our local population. We cannot continue to rely on immigration to meet our population targets. What can be done? We can follow the successful practices adopted in some countries. They do not provide a full solution, but they do have a much higher birth rate than in Singapore. We have to adopt a different approach. We should provide an adequate allowance to the family to raise each child. I suggest that this allowance be $500 a month for each child up to the age of 16 and for a maximum of 3 children in a family. We should also reduce the cost of medical and child care. National service. We now spend $15.5 billion a year on defense. The backbone of our defense is to have an active reservist force of 1 million trained soldiers. We now require our male citizens to serve 2 years of full-time national service, followed by 10 years of reservist training. Apart from this high cost, we require our citizens to spend about 30 months of their life over a period of 12 years. This is a heavy burden on their time. It impacts their careers and delay their marriage and starting a family. A high proportion do not get married. In recent months, we have seen several deaths of NS men and reservists during training. I want to make my views clear on this point. Like most Singaporeans, I consider our national defense as very important. As a small country, we need a strong and adequate defense capability. We need to protect our sovereignty against bigger countries that try to bully us. But we need to discuss the question of what is adequate. Do we need an active reservist force of 1 million people? Would a smaller number be adequate? Do we need to spend $15.5 billion a year on our defense? How much are other countries spending on their defense? How big is their military force? Our defense needs should be kept up to date with the times. We face a different challenge in 2019 compared to the challenges we faced when we became independent in 1965. Our relationship with our neighboring countries have changed over the past decades. They also changed their national priorities and their approach towards military matters. They have to face their own challenges. I have carried out some research into the military strength and budget of several countries that are similar to Singapore. Based on this research, I conclude that we do not need a defense budget of 15.5 billion and take away 30 months from our citizens' time. We need to review our defense strategy. We should not continue to pour in more resources that exceed our actual needs. We have other social and economic priorities to consider as well. Central Provident Fund. Our CPF system used to be the pride of Singapore. It was a good and fair system. It was popular. It helped to build the economic backbone of Singapore during our early years. However, the CPF system has now become quite unpopular in recent years. Some of the complaints are low interest rate paid on the savings, frequent changes in the rules on the use of CPF savings, delay in withdrawal of savings beyond 55. In spite of high contribution to CPF, many people find the retirement income from CPF to be inadequate. Many people have started to distrust the CPF system. They consider it another scheme by the government to take away their savings. We need to revise our approach towards CPF. We need to rebuild the trust in the CPF and let the citizens know they are getting a fair deal. We need to allow the citizens a choice of investing their CPF funds. We need to allow them to earn a market rate of return if they are willing to take the market risk. But we have to provide them a number of suitable options. We should allow them to withdraw their savings at 55, which was originally promised to them. Some of them need to take out the savings earlier to pay off debts and to put to some other suitable use. We should also help them to avoid making disastrous decisions in investing their savings. Too many people have bought the wrong investments or made losses in running a business. This is a difficult policy decision. Both options to allow or disallow early withdrawals have their risks. We need to find an approach that works best for most people. We cannot solve this problem by ignoring it. HDB flats. The HDB system has been a pride of Singapore in the early years. It allowed a high proportion of the people to be homeowners. They were proud of the HDB system. In the old days, the HDB flats were sold at an affordable price, but times have changed. Since the mid-1980s, the price of HDB flats have increased under the Asset Enhancement Policy. These increases went too far. HDB flats are no longer inexpensive. They have become very expensive relative to the earnings of the average wage earners. Many HDB flat owners paid a high price for the HDB flat. They find the flats, they can only afford the flats if they have access to government grants. But the market price for resale flats are too high. Still, many people are willing to pay the inflated prices because they thought that the property will continue to appreciate in value. Their views were reinforced by assurances from government leaders that the HDB flats is a good investment. The HDB owners have now come to a rude shock. They have found that the resale value of HDB flats have dropped sharply after it passed the 40-year mark. They cannot find buyers for many of these old flats. Buyers can only be found if the sellers are willing to accept a sharp drop in value of up to 30%. The HDB flat is no longer a good investment. It has become a high cost of living. There is nothing much that can be done about the fact that the HDB flat will have zero value at the end of the 99-year lease. However, we can make changes to allow the value to decline gradually and avoid the sharp drop in price when the flat passes the 40-year mark. We can prevent this sharp drop if the buyer is allowed to use CPF savings to pay the old flats in the same manner that they are allowed to pay for the new flats. We have to get away from the concept that the remaining lease must last for a lifetime of the buyer. We should also allow younger families the choice of renting a flat instead of owning a flat paid at an inflated price. Conclusion: I am disappointed that the Finance Minister had failed to address the key concerns of the citizens in Budget 2019. We have many challenges that need to be addressed. They affect the future of our country and the livelihood of the people. The many institutions that we were proud of in the early years of our independence, such as CPF, HDB, National Defence, Healthcare, have deteriorated over the years due to neglect and incompetence. The budget is an important occasion for this issue to be brought up and for us to find a national focus to solve the challenges. Thank you.